All right, 8 minutes after 11 o'clock. February is Heart Month. We all know that, right? It's
Yes,
a great month for that, too, because, there's so many heart-shaped things. Does a Valentine really look like a heart, though? Not really. So kind of, right?
Sort of.
Dr. Charles Davidson is on the phone. He's an interventional cardiologist and the clinical chief of cardiology and the medical director at the Northwestern Medicine Bloom Cardiovascular Institute. He's talking to us about how valve and coronary heart disease are diagnosed, what to look for in a doctor or hospital to get evaluated and treated. And this comes up a lot because a lot of people who move here from another part of the country, they often wonder, I like the weather and I like everything else happening here, but is the hospital going to be as good as the one I left in New York or in L.A. or in Philadelphia or whatever? From what I hear, we've got pretty good doctors here. That's what I've heard. So let's find out from Dr. Davidson. Good morning, sir. How are you?
Good morning. How are you today?
I'm okay. Where are you right now?
I'm in Chicago, nice and cold, snow on the ground. And that's something you would not have any familiarity with, I would hope.
Well, maybe, but a lot of listeners do because we have a lot of people who move here from your part of the world.
Exactly. A lot of snowbirds that we half the year down there and half the year in Chicago. We take care of a lot of those patients.
Absolutely. And one of the things that does come up, and it's not a slam or slight against our local doctors, but a lot of people who move here, they're not sure. They say, well, wait a minute, what about doctors? Are they as good as they are up north? So talk to us specifically about the heart issues, and is there a way to know which hospitals have the best doctor for what we need?
So, finding the best health care is not the easiest thing. There's numerous ways of ranking hospitals and physicians that are available on the website. I think one that is often used is the U.S. News and World Report rankings for cardiovascular programs. We're proud to be one of the top 10 programs in the country of over 3,000 programs. So it's a highly competitive one. A lot of those things that patients should be looking for is what the mortality rates at the hospital are, what readmission rates are for the hospital. There's often some information you can gather by looking on the hospital website that does some ranking of their physicians. But it's not easy to sort all of these things out. I think ultimately you want a medical center that if you have a certain procedure, they're doing a fairly high volume of those and can tell you what their results are. And be a critical consumer. And obviously, there's great hospitals all over the country, and that's where you want to receive your care. Maybe the last follow-up to that, and I'll finish, is that second opinions are very important when you're being told you need something done with your heart, and that if someone says you need something or don't need something, it's very reasonable to seek a second opinion. You may go back to that first person to get whatever needs to be done or not done, but make sure you have a fully informed decision when you undertake this.
Can you have valve disease and not coronary heart disease, or does it go hand in hand?
That's an excellent question. Valvular disease is often independent from coronary disease. There's one form of valve disease that happens when you have a heart attack. The heart stretches out a bit and causes the mitral valve, which links the top and bottom of the heart, to leak more. But most of the valve disease and coronary disease are independent phenomena. And the risk factors for coronary disease, diabetes, high blood pressure, smoking, are not really risk factors for valve disease. In fact, many of the things about valve disease is that we don't even understand why it progresses in some patients and not in others.
Does a diagnosis surprise a patient, or do they have an inkling that something is up? Are there symptoms that they're experiencing?
So many patients will just start developing symptoms of shortness of breath, chest discomfort, leg swelling, and maybe never knew that they had a problem. With valve disease, it's interesting to me how many patients will come in and say, I've never known I had a heart murmur. So, back to the question of, was anyone really taking a good listen to that heart? Because that murmur's probably been there for quite a while. I mean, occasionally one comes up suddenly, but that's not how valve disease progresses. And so the symptoms can be very insidious and slow onset, but also if it's a heart attack or something like that, where it's a coronary problem, those can be more sudden onset of symptoms. And then one last thing is that patients with diabetes often don't get symptoms of heart artery problems, and so it's important that they get regular screening because they don't get those typical chest discomfort symptoms.
So when we are having some symptoms in our lower legs, there was we had a doctor talk about that one time. Is that an indication of a heart problem?
So it's a good question. The lower leg symptoms, what we call claudication, so pain when you're walking, is typically from blocked arteries in the leg. And atherosclerosis, or blockages of the arteries, tends to be a diffuse process. So almost invariably, if someone has blocked arteries in the legs, they probably have some degree of blockage in their heart arteries. Those may not be manifesting by symptoms, because think about it. If you have pain when you're walking less, you're not straining your heart as much, and you may not be feeling the typical symptoms. So important, if you have leg artery problems, to be screened for heart artery disease as well. And the same risk factors you'd modify for leg arteries, you'd modify for the heart, which is cholesterol, blood pressure, diabetes, and stop smoking 100%.
Yeah. So does diet and lifestyle, weight loss, for example, reverse some of those things?
So they can help prevent progression. All of these things really help prevent progression. As I tell people, there's no Drano, if you will, for the arteries. There's nothing that really causes regression. We like to get stabilization rather than regression. There's always been the holy grail that maybe some diets can actually regress. That may occasionally occur, but it's the rare phenomena. You're just looking to prevent progression by good, healthy lifestyle and some of the other factors we talked about.
And is there any difference in genders as to who gets more heart valves replaced or more stents?
Yeah, it's a great question. There are gender differences. Women typically have more atypical symptoms than men for heart artery problems. So the traditional chest discomfort, tightness, is not often experienced by women, and therefore they're often underdiagnosed or late diagnosed, and so they can be more advanced in their disease when they get diagnosed. We also know that women tend to develop artery problems later, about 10 years later than men, probably because of some of the protective hormonal effects that they have. When we talk about valve disease, as people age, they develop more valve disease, and because women tend to live longer, we tend to see, for example, more aortic valve disease in women because they just live longer into their 80s and 90s, where men tend to live about 5 years less than women. But it's important that the patients are paying attention to their symptoms, and if they've been diagnosed with a problem, some of these don't have a lot of symptoms, and to make sure they're getting regular follow-up.
A very, very important topic, and the short interview only scratches the surface. Can you give us a website that would help us learn more?
Absolutely. There's a good patient education on diagnosis, prevention, treatments at heart.nm, northwesternmedicine.org, heart.nm.org. I think your audience will find it very informative as a way to learn more about the heart and be an informed consumer of their health.
All right, Doctor, thank you. Enjoy the snow. Just remember, we're down here. We got sunshine. We got the beach. There's at least 3 women in bikinis.
Down to Santee, Clearwater. I'm with you. I can't wait.
Nice.
Thank you, Doctor.